Human Services, Reform, Finance, and Policy Committee. I think the discussions we've had since we left session, starting from September until now, have been productive, and hopefully today will be that as well. My goal on this hearing in particular is to just call attention to some of the challenges that are just everywhere, and maybe some that the public isn't quite as aware of in the group home side and the customized living, individualized support side, which I think is just really a problem. But anyway, we have all new people working for us, not exactly all, but pretty close. And so John Paul Yates is the new committee administrator. So since you already said something, why don't you just introduce yourself and welcome to the committee, JP.
Thank you, Chair. I'm excited to be here. John Paul Yates. I'll be the committee administrator for the committee. So I look forward to working with all the members, staff, and as well as the departments who've already been extremely helpful. So look forward to working with everyone.
Thanks. I want to remind everybody, members in particular, that even though he's hired by the caucus, our side, he works for everybody. And my approach has been to be even-handed and with hearings and all. And if it's a good idea, it's a good idea. If it's not a good idea, then that's treated with the respect maybe it should have. So still encouraging all members to participate. And JP is the vehicle for that. And I have a new LA as well. Kobe, are you there? I didn't warn you I was going to introduce you. Maybe we'll hear from him later. And then we have a new council. Liam is still here. So he's the veteran here. And then we have Alyssa Hoffman-Litchie, and I think she likes being called Allie. Do you want to say hello, Allie?
Hi. Allie or Alyssa, either's
okay.
Fine. Hi, new council started on December 6th, so very excited to be here.
And do you want to just tell us what topics that you've taken on? And it's a massive mountain of topics.
Pretty much everything that Liam is not, but pertaining to today, it's going to be childcare. So I will be the main point on that.
Thanks. And if for those of you who are accustomed to working with our council, she has inherited all of Patrick's pile of work, and Liam is still around, and so he's been amazing. And then Senator Franzen found herself occupied with another project, running her caucus, and she was a great asset to us. But no less amazing is Senator Murphy, longtime good colleague of mine, and even preceding this place. Do you want to say hello, Erin?
Yeah, good morning, Mr. Chair, and hey to everybody. I'm Erin Murphy. I am a new member of the Minnesota Senate. I'm also a registered nurse. I teach at St. Kate's and served in the Minnesota House for 12 years and served for most of that time with Senator Abler on the Health and Human Services committees. And I'm happy to be back in a place that is familiar. And Allie, I don't know what your book of work is, but I'll work hard to figure it out. Okay.
Very good. And yeah, Erin, I'm really glad you're here. You know, this is going to be a challenging time. I don't know where things are going to land, but I'll just, thanks, Erin, for being here. But I'll just tell you my view, and this is only the view according to me. I'm not telling any secrets because I don't know any. But in terms of policy matters, it's going to be quite, I was at a forum this morning and Speaker Hortman was there and she was hoping we would avoid drama this session, and I appreciate her optimism. I think it's going to be a very interesting session with all kinds of deeply held beliefs being expressed by, there's not just two sides, there's probably 10 sides as you get to the different way people look at stuff and factions within caucuses and all that. But I believe we can be successful in policy work in particular And I would just invite everybody who has a good policy idea to make something streamlined or actually survive or work. After today's hearing, you'll even be wanting to do that more. And I believe there's an opportunity with the ARPA funding, which if we can find a way as House and Senate to spend it, then that's our freedom. Otherwise, the governor gets it at the end of session, which I think might drive us to some good ideas. I see quite a bit of division on the 7.7 or 8 billion or whatever it's going to be, where I don't see a lot of alignment on all those 10 factions points of view, and maybe at the end we'll get something together. And I'm interested in being part of that discussion, but for sure, this committee has a lot of really important things to talk about. And today is a workforce, which is the most challenging workforce times, I think, in the history of needing a workforce. I think that's probably safe to say. And I'll just get my, so we're going to talk about that and have a National Guard update. And the governor and the commissioner have come up with some short-term assistance, which I think is great. And then we'll talk a little bit about, I don't know, did the Supreme Court decide? So we'll talk about that later, about those mandates, and not very much detail, just a mention of it. And then we'll touch on childcare a little bit. So in your packets online, you'll see a letter from ARM, and I encourage you to read it. It says here that the situation is really nothing less than grave in terms of staffing, and I'm just nervous that people are going to get a call from their group home and say that their 26-year-old adult child is going to be coming to live with them again. We're going to hear from, there's an article from MinPost talking about some of the personal challenges. And then there's a letter that was sent to the governor December 21st from the Minnesota Consortium for Citizens with Disabilities and Minnesota Council on Disabilities and the Ombudsman for Mental Health and Developmental Disabilities, outlining their extreme concerns. And if you look at the actions part on page 2, they are suggesting to utilize the National Guard to provide home and community-based services. I am going to echo that with an exclamation point. People understand nursing homes because that's where grandma went. They don't understand group homes. They don't understand assisted living with the nuances that many of the people on this meeting do. But given the grave nature here, it's time to call to National Guard to help. And that was not suggested only by me, but by this group back in December 21st. And I know we'll talk about some money that's being sent out. That's not meant to be a confrontational statement. It's meant to be a statement like, here we are together. And I think given the challenges and the budgeting that we're going to be facing with the big bank, the only way to call attention to the challenges in this area would be to actually call it the National Guard. One is to help, but also to indicate how serious it is and people are truly at risk of harm. And then they talk about one-time money, administrative flexibilities, and by the way, always including stakeholders. And last session with these closed meetings and all that, the stakeholders were not as included as well as they could have been and as I would have liked, and that was just a function of COVID. But we want to do better than that. And so for my money, all 9 members of this committee matter and they're relevant. And if a stakeholder talks to one person, that counts as an input to at least the committee, as long as that person lets us know what they're learning about. So with that, we have quite an agenda today.
Senator Abler?
Yes.
Before you go on, to answer Senator Murphy's question about Allie's subject matter, I have that list here. So for her and for the other members, can I go through that real quick?
Please do.
So Allie has most licensing activities, most things having to do with the OIG's office at DHS, and most things having to do with the counties at DHS. For the major programs, she has MFIP, Childcare, Child Support, the General Assistance and Minnesota Supplemental Assistance Programs, Housing Support, formerly GRH or Group Residential Housing, anything having to do with child protection, North Star Care, mental health, substance use disorder treatment, civil commitment, and all of direct care and treatment, which includes the forensic hospital, group homes, and the sex offender program.
Well, thank you. And so how hard could that be? Anyway, so we're really glad she's here. We had some good meetings already. Anyway, any comments from any members before we move into our agenda? I had a chance to say hello. Anybody else want to offer any comment or add to what I said? And by the way, I don't have any staff. I'm sitting home in my dining room. And so if you wanted to say something and I missed you and I don't see your hand, don't be afraid to say something, to interrupt, because this is meant to be a true committee function. I'm looking forward to the days we meet in person again. Anyway, any other comments from members? Alrighty, so to the agenda, I think I got all the preliminaries out of the way. So we're going to talk about long-term staffing concerns, and we've had a lot of testimony over the last, I think this is our 6th hearing, about nursing homes, tangentially assisted livings, and about group homes. So some of the people that would have come to comment didn't see any point in repeating themselves, but a number of people are on the call for advice, and namely the care providers and the imperative folks. So we do have 2 testifiers today on this topic, and that's Tracy Murphy and then Christina Kirschner. So if Ms. Murphy wants to start, that'd be great.
Yeah, hi, I'm Tracy Murphy. I lead Mount Olivet Rolling Acres. We're a disability services organization in the Twin Cities, and we support over 3,000 people with disabilities. That's both in their own homes. We have a day program. We do crisis intervention. We have case management for Hennepin County and Dakota County. We run a summer camp for kids with autism. And then we operate 32 group homes. And to Senator Abler's point, group homes are not nursing homes. They are not assisted living. They are literally 4-bedroom homes in your neighborhoods where 4 people live who have disabilities. And we are kind of a forgotten sector. We are licensed under 245D Medicaid. But we are considered long-term care. It's just that the assisted living and the nursing homes are a little bit more forward in the community. If I were fully staffed, which I haven't been since I've been here in 5 years, we'd have 500 staff. I'm going to kind of walk you through where we're at with staffing, where we're at with COVID, and some of our biggest pressure points, and you'll see that they're really intermixed. And then Christina is one of our supervisors. She will talk through just like real life examples of the people we support and our staff. So staffing has been a crisis in this industry. We call our staff DSPs, or direct support professionals, for over 8 years. And pre-COVID, it was estimated to peak as an issue in 2023. We are no longer in crisis. We're in emergency. We are in a dire situation. I currently have 80 open positions. I'm operating with 30 to 50% of my shifts open at any time. And keep in mind, these are 24/7, 365 hours. And we're literally operating at absolute legal minimums. We are not providing we are providing person-centered care, but we are not providing the quality of life. We are truly trying to just keep people safe. We've moved to daily meetings so that we can look at what shifts are open in the next 24, 72, and beyond hours. And then we are calling people literally to go fill in. I have 23 staff who are not on the residential side. They're case managers, my HR generalist, my IT guy, one of my maintenance guys. They are picking up shifts. We are training them in to pick up shifts. This is on top of their regular jobs. We've already had to close temporarily 3 homes. We have another 2 homes that are closed on weekends because we don't have staff, and we're in the process of closing 2 more homes. We are asking for exemptions for a 5th bed exception, as well as additional ICF beds, so that we can continue to care for our most vulnerable people. But our people who go home on a regular basis, we are asking to go home and stay home with their guardians. This is not ideal. Guardians are not equipped to do this either, and many of them are having to move from full-time to part-time work. retire or quit working altogether in order to take this on. Not to mention the mental health challenges that it's posing. So just for a minute, as I talk through the rest of this, think about, you have an intellectual disability, you probably also have a physical disability, and most likely an undiagnosed mental illness. You need care and supports, right? You might be nonverbal, you might need help going to the bathroom, brushing your teeth, having meals, or you might be fully reliant on someone for your care to do your showering, changing you, etc. So now imagine that you see somebody different every single day. Somebody different is showering you every day. Somebody different is feeding you every day. For the people that we support, consistency and routine is their therapy. It is what helps them stay stable. So just, I want you to think about that in a context as I talk through our staffing issues. We have 2 homes right now that are working with 2 to 3 staff, 12 on, 12 off. I have more than 5 staff that haven't had a day off since the middle of December. And we've got some staff sleeping in basements so that they can be there for their next shift. This isn't safe. It's not sustainable. It's increasingly risky, very difficult. And in full transparency, we were recently cited with unintentional maltreatment. Fined because we had so many on-call staff working in and out of this house because we didn't have enough permanent staff. They didn't really know each resident, and one of the residents injured themselves and lost part of her thumb. So I have to own that. That wasn't one person's failure. That person's day program didn't notice. Our staff, because they were in and out and maybe hadn't worked there in a week or a month, didn't know how to work with her optimally, so to speak. This is going to happen more and more, despite our best efforts to keep people safe. If you don't know the people that you're working with, if you're not working with them on a regular basis, and if they don't know and trust you, things are going to happen. So that's without COVID. Okay, let's add COVID into it. Right now, I have 11 of my 32 homes are on COVID restrictions. 60% of my homes have had COVID since Thanksgiving, and 4 of my homes have had COVID more than once since Thanksgiving. Why is this important? Well, it's tricky because if you are in a home that gets designated as COVID positive, you can only work in that home. So we are very used to right now, and we need to spread our staff across homes. And now we've got people locked into homes. And that doesn't even include the risk to our staff themselves, right? The vaccine mandate, I am all about personally making sure that everyone is vaccinated. But however, with the new CMS or with the CMS mandate, we need to be at 80% at the end of this month, 90% in February, and 100% in March. I am at 80% right now, but my last 20%, those last 80 people that need to get vaccinated are refusing and adamantly refusing to get vaccinated. What am I going to do if another 80% or another 80 people quit? I already have 80 open positions and we're already barely filling our shifts. Then I'll have 160 open positions out of my 500. We need weekly testing options, not 100% vaccine mandate. And we need those staff that are choosing not to vaccinate, not only to test weekly, but to wear N95s, eye protection, et cetera. So there are accommodations we can do to keep people safe. Short term, we need relief funding. We saw none of the funding that went to nursing homes and long-term care facilities. In fact, one of my partners is Mount Olivet Careview Homes. He called me up and said, I'm 98% staffed and got a check for $500,000. I don't know how I'm going to spend. He goes, I wish I could give it to you. I wish he could give it to me too. We are paying retention bonuses, hiring bonuses. We are paying hero pay. We are paying differentials on hard to fill shifts. We are paying our non-residential staff to come in at $25 an hour on top of their regular salaries. And this is all without funding to support this. This is all just on our base pre-COVID funding. And we need relief funding without cumbersome oversight, without cumbersome paperwork, and without restrictions. Our finance team is already under a lot of pressure with all of the differentials and extra pay we're doing. They can't take on more. And then we need relief staff. To Senator Abler's point, we need people I was watching the news last night with the nurses. That is exactly what we need as well. I would also mention I have a nursing team. If I were fully staffed, I'd have 8 nurses. I have 3 right now. So I have 3 nurses trying to support 32 homes and 130 people. Long-term, we need total and complete system reform. We cannot just make what we have better. We cannot just tweak it. How the work is valued, how we're reimbursed, how we're monitored, how we're licensed, how we're educated, how we recruit. It just needs to be flipped completely on its head. It doesn't work. We're exhausted. We're scared. We're at the end of our ropes. I lose sleep. My blood pressure's off the charts. There's anxiety and mental health concerns, not just with our staff, but with our residents as well. That's why I don't have a client. Any of my very strong advocacy clients have their mental health is too fragile right now to have asked them to come and testify with you guys. And the current solutions, while I really do appreciate the current solutions, are too bureaucratic, and they clearly show a lack of understanding our business model. So for example, the DWRS increase of 8.5%, that to us in net dollars this year is only $150,000. I run a $40 million business. This effect, and part of that is because it only takes effect until the client has their annual review, which for us is mainly in the fall. It only covers certain services that are delivered by certain staff. So it does not include any of the nursing support we do. So 8.5% sounds like a lot, and it's 20 cents per hour. So I get to give my staff a 20-cent increase for all the hard work that they've been doing. Clearly, the people making the decisions, and I'm not being judgmental, you just clearly don't understand our business models. And so I'm just really asking for full system reform. ARM did an amazing job with their requests, so I would encourage you to read that. The MinPost article was an article on our organization and interviewed people in our organization, so please read that. And I'm just letting you know, those are the facts. I'm raising the red flag. We need help. I mean, we're drowning. And I just really, really appreciate the opportunity to speak with you. Christina, she is our supervisor. She runs our respite program. We've had to close respite. She's also right now taken on 2 of our ICFs that have been under COVID restrictions for the last 3 weeks. And so she can talk about, or she will talk about the impact to staff and the impact to clients.
Holy cow, Tracy. Ms. Murphy, that was just tragically remarkable, what you said. And I'm happy we can get it at least out in the public. The thing I sense, and I think you said it really well, is that really nobody, you're like the invisible part. Unless you have a family member or somebody you know who's in one of your residents or served by you, it's not commonly known, and it actually doesn't even rise up very far up the notice level within, you know, within the system. And so I'm really glad you just were eloquent, and I'm just about to weep. Anyway, so we'll hear from Ms. Kirschner, and then we'll talk about this a little while. And as I mentioned, when we get talking about that, the members are certainly welcome to offer their thoughts. And then, so anyway, Ms. Kirschner, welcome to the committee.
Thank you. I'm Christina Kirschner, and I run a respite site for Mount Olivet Rolling Acres. We're located in Bloomington, and we serve children and adults with disabilities from Thursday evening to Sunday evening. So a lot of families will bring their child once a month to get a break from the everyday cares that they do. In May of 2020, I was asked to shut the doors due to the guidelines by the CDC and the Minnesota Department of Health. And we stayed closed until 2021, April. Although now in December, we had to close again because of staffing issues. During this time that we were closed, about half the individuals that we served left. They moved into group homes because their family just had no services for them. People can't find PCAs, they can't find camps. There's nothing out there right now. And I get calls from these parents every day. So during the time that we were closed, I served on the COVID response team with my company, and we put together this team of just a couple of people to help cover staffing gaps when a house had a COVID positive individual. So like many businesses, there were several people in the company that decided to take an extended leave of absence or an early retirement when COVID hit. And when we had COVID positive people in a household, excuse me, another wave of people decided they were uncomfortable working. Then on top of that, any staff that was positive was asked to take time off. So often this left me with just a couple of other staff that were able to work. So I worked long hours. I sometimes brought individuals to the hospital or cared for them while they were on hospice. And it was not easy. And the whole time I knew that these people would rather be with staff that they knew and trusted and would get better care from those people. But none of that scares me as much as the staffing crisis we're going through right now. The stress of this last year and a half has left its toll. Our company is really struggling, as Tracy explained. When respite closed, I was able to help at a lot of homes. And right now, because of staffing, we had to close again because there's just no one to work. As a supervisor, it's been really hard to hold people to high standards that the individuals that we care for deserve. I just don't know if I can always mention to someone something that they're doing wrong because I know that they can make more money at a manufacturing job or retail job. We're struggling with ethical questions. Can I really approve 70 hours per week when I know that the staff is not going to bother doing anything but the bare minimum for these clients? I struggle with it myself. Should I pick up an extra shift, or is 52 hours enough when I have a 6-year-old daughter to raise? And can I really give these people the care they deserve when I'm at that many hours? I have my limits too. Last week, I worked over 78 hours in a COVID positive home where other employees also worked a lot of hours. One of my colleagues worked 79 and a half hours, and another one worked 60. We had a lot of staff out sick. So sorry, I lost my place, but it's not healthy and it's not sustainable. When you call your 6-year-old to say goodnight and you can tell she's crying because she misses you, that is too much. And a lot of really great people have left this industry because of what we're facing. And when these people leave, they are not coming back. Like some of Tracy and I have seen a lot of really great supervisors go. And so that's the one point I want to make today is even if we do get more funding, the damage that's been done with like these wonderful people leaving and them not coming back is really not able to be undone. So sorry to leave you on that depressing note, but.
Well, we did ask you to tell us how it is. You've both been eloquent, and thank you for the way you serve. And I'm just sad about your daughter. And what people, I've been on this topic a long time, as well as many of the members here and staff. And I think one thing that's common to all of us is we remember the people involved. I think universally, it's not a political matter who members, but this really helps to even cement it in more. But I don't think that the folks that don't get to hear this all the time really understand, and that's actually the purpose of today. So hopefully that individuals who don't spend time on our committee will come back and look at this half hour or so. Anyway, comments, questions from members? Anybody raising their hand? Okay. Anyway, don't be shy. Just to bring us up to date, some of the imperative people are here. Do you want to just give us a little thumbnail of where you all are at with the nursing homes, assisted living, just to kind of at least fill in the gaps? I don't know if Mr. Pearson is here or whoever. So I see you unmuted yourself. Yeah, go ahead there, Toby.
Thank you, Senator. Mr. Chair, Toby Pearson, Care Providers of Minnesota. I'm here with Carrie Thurlow, who's also with Leading Age Minnesota, your friends at the Friendly Imperative. I think we can give you just a quick update.
That's what, yeah, just a quick, that's fine.
So a couple things. First, I know a lot of people are wondering about kind of where the vaccination rates are for our employees. I can tell you that our most recent survey that we did showed somewhere in the neighborhood of 80% of our employees have at least one of their shots. So people are trying to work towards complying with the mandate. Assuming that the mandate goes through, we, as you mentioned at the outset, we haven't heard from the Supreme Court where that lies. Approximately 90% of our residents continue to be vaccinated. I think as far as workers go, what we have seen in our most recent surveys, we've seen somewhere in the neighborhood of about 15 to 20% of our workforce has been lost in the last about 8 months, which numerically, that's a net. So you lose a bunch, you hire some more. So you're ending up, with a severe loss of workers. Everybody's seen the stories. What that ends up happening is you can't take admissions from the community. You can't take admissions from acute care. We've been working diligently with MDH as well as DHS on a couple topics. With MDH on things like how can we get more of the National Guard in a number of facilities? How do we stand up some more of the quote unquote step down or step away from acute care facilities using National Guard and others in other facilities? So we've really been basically triaging for the last 6 months how to keep as many places open as possible. And we have lost a few, specifically nursing facilities in the last couple months. That just had to close for a variety of reasons, mainly having to do with staffing. I think some of the rate setting stuff that you'll probably hear from DHS, we've also been working with them. As you know, a big, huge problem we had in the fall heading into this time frame was what are rates going to look like when you have rising expenses and lowering income. We've been working very hard with DHS to come up with a plan that will work so that we don't end up with even more closures. We think we're getting close to that. You saw some of that in the releases from the governor's office. So we'll let DHS kind of explain more of the details on that. That's kind of a big picture stuff. I'll turn it over to Carrie if she has more.
Can one of you comment about the closures that have happened or that are looming? I'd like to hear about just a comment about that. You don't have to go into depth, but I know there are certain members have told me that they're having nursing homes that have closed in their districts. And there seems like a disconnect between the Department of Health and that. But if you can just give me your best update, either you or Ms. Thurlow, I would like that. Thanks. Maybe Ms. Thurlow can do that one.
Good morning, Mr. Chair, members of the committee. My name is Carrie Thurlow. I'm the president and CEO of Leading Age Minnesota, here on behalf of the Imperative as well. I would echo Mr. Pearson's comments that we have seen a few closures of nursing homes in the last quarter of 2021. And we do know that there is some conversation amongst nursing homes really expressing that they are in crisis and at risk of closure, notwithstanding some emergency aid that has been made available to them. Mr. Chair, I'm not exactly sure to what extent you'd like us to comment on, but, I can't underscore, I think we've been to your committee multiple times and indicated that we are no longer in crisis, that we are on the brink of collapse. And certainly some of those nursing homes have given way as the acute staffing crisis does lead to historically low occupancy that makes it very difficult to continue to operationalize these settings. I don't know that we can necessarily predict how many more closures will occur. These are obviously sensitive discussions, but I do know that it is increasingly part of the vernacular as care centers continue to discuss. Particularly, I would say that smaller care centers that are particularly standalone without necessarily a corporate infrastructure to support them could potentially be at greatest risk. But I'm happy to answer questions about that. And then, if there are other questions, I'd be happy to take those from the committee as well.
I'll just finish up with one and then see if anybody else has a question for you or the Rolling Acres folks. So do you have any idea what percentage of nursing homes are just, I mean, I'm sure some are maybe, the word fine is, they have a sniffle, there's probably nobody like just living the good times. But so those are gonna endure, but how many do you think are at risk? Are we up to 20% at risk? Just a number of you, I don't know if you're hesitant to give me a number, but go ahead.
So, Mr. Chair, thank you for that question. And perhaps Mr. Pearson has direct data. I'm a little bit hesitant to give you a direct number because the situation is so rapidly evolving right now as we're being heavily impacted by this most recent peak. So the most recent data that, and perhaps the Department of Health also can comment, back in December, the Department of Health collected information from care centers and asked them a series of questions that would categorize them in sort of red, orange, yellow, green in terms of how close they are to crisis. And that has really helped inform, for example, National Guard staffing strategies and the like. I don't remember how many facilities were in that red and orange category. Those would be the most at risk. So I may need to phone a friend on that. But what I would reflect upon is that even though that data was collected in December, and that seems like not too long ago, the situation has rapidly deteriorated. And the imperative is currently working on collecting and updating our information. So I would also commit to you that as we get additional information, we will certainly share that with you as well.
Well, thanks. So Ms. Rydrick, I think you're here. Can you just remind us about what the red-orange data was from December, please? If you have that at your disposal. If you don't, I didn't prepare you for that question. So if you know offhand, it would be nice.
Yeah, let me just up here. Senator, Mr. Chair, are you able to hear me?
I can, yeah.
Okay,
perfect. I think we had a double that one time, so it's better.
Yeah, I generally have to have both my phone and my computer going at the same time and see which one gives me better luck. So I end up switching. So Mr. Chair and members of the committee, thanks for having us here today. And just for the record, my name is Diane Rydrick and I'm the Acting Assistant Commissioner for the Health Systems Bureau here at MDH. I do not have the most recent results of that red, yellow, green survey that Ms. Thurlow referred to in hand right now. We can certainly get that over the course of the hearing and get it to you.
Oh yeah, we'll
the last time that we did it was at the very end of October, and there were a significant number of facilities that were indicating that they were at that crisis level, more severe for nursing homes than for assisted living. But I don't think there's anyone who was then or is now fine. Everyone was stressed then, and as Ms. Thurlow notes, more so now because so many of their staff are out with Omicron.
So Ms. Rydrick, that's not December data, it's October data. Is that right? Do you have anything newer? Ms. Thurlow, I thought you had something from December.
Mr. Chair, we have not done the survey again. We've talked about doing it again, but are really worried about over surveying people when they are swamped. And so it's been a while since we have done it. It may have been November rather than October. I can try and find the last one.
Well, let me offer you a short survey. Just send everybody an email and say, how would you rate yourself? Green, yellow, red, and then just they kind of know what that means, and just a thought. So maybe I'm not trying to be too facetious, but thank you.
No, I don't take it that way, Mr. Chair. And we did develop this survey. Have been considering
because as policymakers, we really need to know. And I think Ms. Murphy, you're not in charge, but I know the ARM people are listening, and I would think that maybe if ARM and I don't know more and all these different groups would ask people how is it going, because I think we really need to know. And I think Otherwise, it's kind of, anecdotal, and not that your testimony wasn't profound, Ms. Murphy and Ms. Kirschner, but so I'm asking the governor to call it the National Guard because you're telling me that a lot of the whole story you have is just critically a crisis, emergency, collapse of an industry. But the more information we have, the more we can persuade the industry we're in, which is the legislature, to write a check. And I'm just going to review the suggestion from ARM in the letter that it's in your packets. They suggest retention bonus payments to the end of 2022. That'd be one-time money. A grant program to help childcare costs for DSPs, that could be done with one-time money. Scholarship funds, which I'm a fan of. 5% rate increase. That's probably going to be tied to the big bank. And then the competitive workforce factor, which would be part of a budget bill. I do want to disclose that it's my intention to advance a bill as soon as we can, trying to help fund some of this stuff. And so there's a lot of internal things that happen that has to happen to make that happen. But just so you know, for my money, leading this committee, I'm going to try to persuade anybody who will listen to me that we need to do those first three things for sure. The first two in particular, for the I'll just call it the group home niche and the people that are on customized programming and independent living. If half the people that were living on independent are now going to group homes, there's nothing good about that. That is not a success story. It's not part of any of our policy. I was impressed to read the flexibility that the MCCD and the Council on Disability and the Ombudsman suggest that, even though we want to do independence, we got to let's keep people served, at least living safely where they are. Anyway, so we're about to close this segment out. And I just want to thank all the participants. Any comment from members? We must have covered it really well. So this is part 5 of this topic. And I just want to, I'm sure a bunch of the DSPs and the group home workers and nursing home workers and assisted living workers and those that are helping people independently and parents worried about their kids are maybe watching this. So we got it. We got the message. I know the administration is working on some things, and I think this is a time for us to pull together in that way. And so we're gonna hear about some things they've done. I'm understood that the comment that's some of the solutions are heavily bureaucratic, which I'm a fan of not having it be that way. So maybe, so let's move on. Thank you, everybody, for that. Like, holy cow. Ms. Rydrick, glad you're working there. I don't need a very long update, but just a little short version of how the National Guard is working with the nursing homes. I know they were there for 3 weeks. I'm sure some have done that cycle and they're gone, and what's the future? And I'm just still, actually, as I'm thinking about it, I'm puzzled if you don't have an updated red, orange, whatever, red, yellow, whatever thing. How do you know where to send the next batch? But anyway, Ms. Rydrick, welcome to talk about that.
Yeah, Mr. Chair and members, I guess I don't need to introduce myself again, but thanks for having us here, and really thanks for holding these hearings on a regular basis so we can stay connected on this. Whether this is number 6 or number 600, I don't know, but
Like
it's been, yeah, but it has been really helpful to get together and hear about these issues. And as I was saying, relative to the testifiers and Ms. Thurlow, none of the facilities are fine right now in this industry. They're under incredible strain. And we're seeing with both the long-term care facilities and the hospitals, this Omicron wave is really rolling hard over settings that are tired. They're exhausted, and they've got, 10%, 20%, whatever percent of their staff out now too. And that's really hard. So a quick update on the National Guard. So we have had, you asked how we know where to send the next team if we don't do the red, yellow, green survey. They apply. So we have a process through which they can come and apply to us for a National Guard team, and 70 nursing homes have done so since we began this process a couple of months ago now, or 6 weeks ago now. The applications have actually slowed significantly after the holidays. In the first 2 weeks of December, we had 28 facilities apply. In the last 2 weeks of December, there were 12. And then in 2022 so far, in these first 2 weeks of January, we've only gotten 6 applications. So I do think getting over the hump of the holidays, where there was even extra strain related to people needing time off, getting through the holidays was really helpful. And interestingly, we had at least one facility that applied for a team, got a team, the team was about to deploy, and then they said, you know what, we've been able to hire some additional CNAs and we don't think we need the team at this time. That only happened once, but it was a positive sign. There are 31 facilities that have received a team. Just 5 are currently on the ground. So the others have completed those 3-week missions. And for the most part, if a facility hasn't gotten a team, it's either because they were in an outbreak at that time, and then we refer them to our outbreak team and we support them there until they get through it. And then we put them back in the queue for National Guard. And then there were a few cases where once the National Guard team went out and did their assessment, they determined that the facility just didn't have enough vacant shifts for CNAs. Like their need was more for RNs, which the team couldn't provide. And so there were some facilities that ended up not getting a team for that purpose. So most of the, yep.
Oh yeah, did you want to finish your sentence? I thought you were done.
No, I was just going to note that we are now using some of these CNA trained National Guards to provide support to facilities that are having outbreak-related staffing shortages too. There's an interplay between these two teams, but some of the National Guard troops that have been trained as CNAs, if we're not using them for these crisis staffing response teams, we're using them for the facilities that are in outbreak. So they're still supporting long-term care, and we're still making use of that same cohort of Guard and just trying to use them as efficiently as we can to provide support.
All right. And I didn't really talk to you much before this hearing to prepare you for anything, but you've been helpful. The governor was, maybe you know something on the update. I could have had Minnesota State talk about this, but the governor was going to try to reach out and get 1,000 CNAs by giving them tuition, et cetera. Do you know how many people have matriculated into that offer?
Mr. Chair, I do not. I don't know if MnSCU is here today to speak to that, but we could certainly go back to them and have them come back to you with an answer. My understanding has been that uptake has been great, and they've really been moving forward and seeing a lot of interest. We've also been having community meetings in counties where there are nursing homes that have a National Guard team, and bringing in the schools and the superintendents in the school districts and the higher ed programs there, and talking to them about how can you encourage students to come into these programs? How can you encourage students to be CNAs and move into the caring professions? So we've been having really good luck with those conversations too.
And part of the challenge, and I think every member of this committee is aware, so once you get him in the door, how do you keep him as a career? So many of the people who have left, as listening to the testifiers today, people are leaving, it's because they just can't afford to do it. They need benefits, they need some amount of money, and it's in my town, McDonald's was offering a $500 hiring bonus to pay $15. And we're doomed. If that's, and these people offering $25 per hour bonuses, and there's no way we have that kind of money, and they still can't get people. We've heard from the last time, Miss Peterson from Broda, I think it was offering a big bonus and couldn't get it. Alrighty, any questions about this from members? Thank you, Ms. Ryder.
Hey, Jim, Senator
Hoffman, yeah.
So just to help, and this will probably go into the conversation you're going to have about the home and community-based services, regarding the role of the National Guard. But Diane, are all of our Medicaid nursing homes that are the entitled side of it? Every nursing home in Minnesota is considered that the term that is used is that it's a certified Medicaid nursing home. Is that correct?
Yes, Roderick.
Mr. Chair and Senator, I might have to phone a friend, but I believe that there are a handful that are not, but no more than a handful. And I see one of my colleagues here is typing me a note. It's the beauty of remote hearings is that you can get help from your subject matter experts in real time.
That's funny. But thank you, Mr. Chair. Because as you look at our Medicaid program in Minnesota, right, the real only entitlement that exists is nursing home, right? Is that long-term care to seniors in nursing homes. That's kind of the only real entitlement. Everything else is structured under 1915 or waivers. And it's like, there's this dance in between there that, I'm having a hard time grabbing on how are we going to assure some, consistency across the board and helping relieve some of these folks that are providing services to the most vulnerable people in the state of Minnesota. And so I'll bring this up later as you talk about, perhaps how we're going to help with the HCBS. But, it'd be nice to get that information from Diane. Just, you can email it out, Diane. That's fine.
Senator Hoffman, I believe also the people on that are currently on waivers are entitled to an ICF.
Correct.
Which is an ill-defined entrance level of service. That's a whole different meeting. So.
Yeah, thank you.
All right. So Commissioner Harpstead, I don't see any more hands. Welcome. I know you've been working on some plans, and I want to just thank you publicly for your work on some of this and your interaction with the 4 chairs, which I think is a model not really found in some other niches of state government. So I appreciate your experience you bring from your past and your commitment to everybody. So with that, I don't know if you have a handout, but if you want to explain what you're doing with the new assistance programs. And then also, I'm going to ask, just as we have a conversation about some of the bureaucratic parts, maybe we'll just even talk about that briefly, not to embarrass anybody, but just to make it even be more useful. So that's my agenda on this little piece here, I think, just learning from what's going on earlier. So Commissioner, welcome to the committee.
Thank you, Chair Abler, committee members. I'm Jody Harpstead, Commissioner of the Department of Human Services. I am deeply concerned these days about the Minnesotans who work in what I call the caring professions, all those frontline workers we've called our heroes throughout the pandemic, and the people they support and their families. Hospitals, nursing homes, assisted living, services for people with disabilities, behavioral health facilities, home care, and childcare. Together, they make up 15% of the Minnesota workforce and care for up to 30% of the Minnesota population. And they have an average wage 30% less than the Minnesota average. The providers of these services are now trying to weather the Omicron surge, and 2 sectors in particular, nursing homes and services for people with disabilities, are part of the hospital surge capacity equation. Of course, nursing homes are the traditional sites for discharging hospital patients. And recent calls with hospital CEOs have also shown that people with disabilities are occupying hospital beds, waiting to be transferred to community services. We have added staff to work with counties to expedite MA eligibility to move folks to the care settings where they belong. As an aside, we've also moved 14 more patients from community hospitals into our direct care and treatment facilities last week. And we've added staff to support counties moving patients out of DCT to community settings, and sent behavioral health mobile crisis units to ERs to pick up folks with behavioral health needs to support them in their homes. Services for people with disabilities also lost access on 12/31 to the emergency staffing pool we stood up with executive order authority last year and that the legislature extended to the end of 2021. Our DHS staff worked over the holidays to design supports that would allow these sectors to get through the Omicron surge while judiciously using the authorities we have with as little budget impact as possible. So first, in terms of our nursing home support, the 2022 rates for nursing homes have not yet been fully determined. We have cost reports in from providers with 2020 data as usual, but they're not yet audited as usual. The decision we've made is to give nursing homes a temporary 2022 rate as soon as possible, relying on the unaudited cost reports to be trued up, including retroactive corrections when the audit is final. This would give nursing homes an immediate 5% increase on average with no forecast impact, as 5% was in the November forecast. And then as we did throughout the pandemic, or most of the pandemic anyway, we are also looking at using statute 12A10 to allow especially hard-hit nursing homes, those who are red or orange on the MDH chart, to apply for specific facility needs from January through March. Proposals would be read by DHS staff and funds distributed as appropriate. These funds would be trued up when the facility's value-based reimbursement is calculated 15 months later. So the budget impact is one of timing, not incremental spending. Very few facilities took this step throughout the pandemic with other sources of funds available. If all the red and orange facilities applied, they could draw down up to $31 million, $15 million of that state share. In terms of services for people with disabilities, we are looking at doing a 5% rate increase on all claims for corporate foster care, ICFs, and DSPs in people's homes from March through May, intended for staff hiring and retention incentives. This requires Medicaid approval, which we fully expect to get, so distribution of funds starts in March. This would provide $26 million state Medicaid forecast impact, with a $26 million federal match with the enhanced FMAP that we have through March. Mr. Chair, this is one of the simplest funding options we have ever provided to providers. Right now, it's simply a rate increase and add on to their current rate to be added through those 3 months. No bureaucracy needed. Once again, these supports were intended to get these two sectors through the Omicron surge to alleviate hospital surge and frankly, to bridge us to the session where we could continue to talk about supporting all the caring professions over the next years as they face the rest of the pandemic and the long-term workforce shortage. Happy to answer any questions you may have.
Thanks. And there's also a package for, did you mention the community-based programming? There's another program about that. You were talking about nursing homes in particular, I think, unless I just dozed off for a second in the middle. You talked about something, there's like 50 million for the ARM people. Did you cover that? Yes.
That's okay. The 5% rate increase, yes?
For the home and community-based places?
Yes.
Oh, that's the 5, okay. And so the value of that is about, okay, there have been a couple of versions, so I'm sorry,
it's about 52 million.
52 million. And so that's gonna go out, and you said that's for 3 months? Is that what
yes.
I got? So that's going out now. So, and that's gonna hit soon?
So we are waiting for Medicaid approval. And so we would expect to begin distributing funds in March, and we would have the rate add-on from March through May.
All right. Do you have a paper on that we could get out to people? Did we have a handout on that? I don't know if we did.
I don't know either.
Okay, so if you can just get that out, then Mr. Yates can get that out.
It has been sent out to providers via guidance.
Okay, all right. It'd be nice to see that for the members, and then I wouldn't have to ask dumb questions. Well, that's good to hear. Ms. Murphy, is that good news for you?
Yes, we are very excited about it. With the 8.5%, we're able to do a 2.5% wage increase and announce that to our staff this week. We are doing COVID bonuses next month to our staff that were built into our budget, not reimbursed. This is just what we believe is right thing to do. So getting the extra funding for March through May will help us continue to just thank and recognize our staff for their.
So that's going to backfill what you've already done. So you're not going to do anything new. You've already kind of broken the bank on what you're trying to do, right?
Well, the money we've spent. So we will use this incremental funding to give another boost to our staff. Yep.
All right. Do you know what that's going to amount to?
I don't know the details. The governor made an announcement yesterday that ARM can get you the kind of decree, and I think we're waiting to understand how it'll be distributed and what sort of logistics we need to follow in order to distribute it.
Yeah, and I'm glad that's so timely. I'm happy to give credit where it's due, and I want to thank the commissioner and the governor for recognizing this. I know it's not gonna, there needs to be some more, and that's the purpose of what we're trying to talk about. And so in the next, it's my goal to have a hearing in the first week or two of this committee talking about a funding package to try to expedite that if we possibly can through all the gamut of drama and politics and all of that. But if anybody listens to your comments, Ms. Murphy, you would have a hard time saying no to that, I think. And so with that, I'm gonna just remind to call on ARM and you and other people who are not you, you're busy up to your neck. So don't work more time on this, Ms. Murphy. But for those that are out there listening and who need something to be done, we need to know what that is. And but we just cannot have this system collapse. That's all. So any questions for the commissioner or comments? I don't see any hands, but if I missed you, just speak up. Okay. I think this is a productive time together. Commissioner, any last words on this topic?
No, Chairman Abler, that's what we have to say today.
Yeah, and I know we'll be working together on this, and I hope that what we bring forward when we do will not be a surprise to you, and that will, you may not like everything, but you'll be aware of it. And so that's my goal in this, to try to actually accomplish something. And so if there's some policy matters to expedite and some money we're going to try to work on, those projects may need to move separately just to get them done. And I will be having many more conversations about some of that. So Ms. Rydrick, I bet I got news that the Supreme Court didn't rule today. So Ms. Rydrick, you want to say what you've got? Kind of this is a softball question. Hey, what do you know new, Ms. Rydrick, about that mandate?
Well, Mr. Chair, there is new news now.
Oh, there is.
So yeah, there is.
Oh.
I mean, well, it depends on new, how you define new, last couple of weeks.
Okay.
So just really briefly, so I think most of the members know that there have been a couple of lawsuits related to the CMS vaccine mandate, that they've been working their way through the courts. And as you noted, up to the Supreme Court. There was an injunction in early December that covered 25 states, not including Minnesota, and then another that was a nationwide injunction. And so while that nationwide injunction was in place, we were on hold with regard to the mandate. Then the nationwide injunction was lifted, and stayed in place for 25 states, but lifted for the nationwide. Through most of December, what we were told from CMS was that even though the injunction had been lifted for Minnesota and for 24 other states, we should not enforce the mandate. And so that was the case through December 28th. And on December 28th, CMS issued a memo and directed Minnesota and the other 24 states that are now not covered by an injunction that we should begin enforcing the mandate. So the mandate is back in place in Minnesota, and CMS issued new deadlines for vaccination for facilities that are covered by it. And they now have to have their first dose by January 27th and their second dose by February 28th. And as one of the testifiers noted earlier, there is somewhat of a glide path for facilities that are at the 80% mark, that they can get some additional time to get to 100% if they have a really solid plan to get there. They would still get cited. We are required to cite them, but there wouldn't be a penalty attached to that, and they have more time. How much of a grace period that really gives, I think, is unknown. As the testifier noted, I think a lot of the facilities that have gotten to that 80% point, they're doing everything they can to move those remaining 20% of people, and they may not be able to get there. So I think it gives them a window. It gives them a lot of time before any penalties apply. I don't know how many facilities will really be able to get there, but they've been given that grace period.
Do you know what the penalties are?
Mr. Chair, there are increasing penalties for any facility that is in violation. So it can go from, the most extreme cases are obviously, financial penalties or closure, but the early stages of those accelerating penalties involve us just working with them and counseling them and working to get them into compliance before they kick in.
But at some point they could be terminated as a Medicaid provider. Is that a possibility? Is that, maybe you could send that out to us if you know what they are. That would be, I think, useful for the public and for, because you have a way of distilling things, and presumably it's going to be reliable because you guys spend your time reading all this federal stuff.
It's not easy read, I'll tell you that. So Mr. Chair, yeah, we can definitely send out some information to the committee about what those progressive penalties are. But I will say we always work with the facility to bring them into compliance and to really help them get there if we can. And so,
Right.
you know, those increasing penalties are not things that we enjoy or want to do. So we really want to work with them to get them into compliance. And that's been a strong message from CMS too.
Right. And there are medical and religious exemptions baked into that. All right.
That's correct.
That's helpful. Any comments from members? All right. Well, we'll be interested to see what the Supreme Court does. And if the Supreme Court, I don't know, we should have a pool, I guess. I was just reading, it seems like the court might strike down the OSHA one and keep this one. And so who knows?
Mr. Chair, people have lost a lot of money betting on what the Supreme Court's going to do. So I don't think I would go into that pool.
Oh, really? Okay. I just, that's fair enough. And then when it comes to religious exemptions and medical exemptions, who arbits that? If the nursing home or facility awards someone an exemption for one of those purposes, do you all say fine, or do you have to look it over?
So, Mr. Chair, it's the facility's responsibility to develop exemption processes that are consistent with federal law, and then to document that process so that we understand how they reviewed and granted exceptions and how they made those decisions. CMS advises us to look to the federal guidance and then apply that in our conversations and our regulation with facilities. But it's on them to develop a process that's in compliance with federal expectations.
All right, well, very good. Any questions about this? And so I think that people are keenly interested in this. I know there's other ways that the providers can learn about this, but I don't know how I learn about it or the public. And so the information I've asked to be submitted, maybe Mr. Yates can put that out on our listserv somehow. Since I don't know how to do that, I'm not that person. I just want to offer one more thought on this topic. And the governor just in yesterday's paper is spending $40 million to get 350 people, if it's nurses or whomever from some agency, to go fill in the gaps. And just trying to keep it in the straight and narrow here. One of my concerns has been about the proper treatment of people that have a bona fide religious conviction, which to me is a bedrock principle of stuff. And I'm not going to go very far into that. And I know a good number of the people that have been let go, Mayo let 700 go, Care, I think 426 or 9 or something, over some of these issues, which I thought was not fairly done, frankly. And so if you add up all those, I know Alina did better. I think they had 100 or so, which was, I commend them for being at least more reasonable. If you add up all those, it's got to be pushing 1,500 or 2,000 people across the state. And then to spend $40 million to get 350 back, it's not going to replace those 1,500 people who actually were really good employees, dedicated, talented, committed, and honest about their convictions. So and $40 million, there's not enough $40 million to go and around. Anyway, thank you for that. Let's see, Ms. Brown, we're going to talk about childcare a little bit. So all these topics are so serious that we're talking about people's serving human beings that need to be kept safe, keeping grandma safe in the nursing home or grandpa, helping people with special needs and intellectual disabilities safe and thriving. We're beyond thriving now. We're at the point of helping them, keep them warm and fed. And I just want to, as we leave this whole topic, I just want to thank again the people that are working. And I think that too, Ms. Murphy and Ms. Kirschner are exemplars of why it even works, and putting their own life on hold over dedication to the people that they just took a job to serve, and now they love their people. So thank you for that. So leaving that whole topic, more to come. So Ms. Brown, thanks for coming. Is Amir there somewhere? There's two things that we're interested in hearing about you from is the status of the how those grants are going and how many of the centers and licensed homes, what percentages or whatever have been applying for those, how it's going. I'm curious about what the emergency money is going to look like, the 22 million. And then we'll talk about your updated guidance on quarantine. So if you want to jump at that any order you like, would be great.
Excellent. Can you hear me okay?
Yeah, great.
Okay,
Like that
great.
Verizon commercial. Sorry.
Can you hear me?
That's a bad joke. I apologize. That's totally wrong. So, welcome to the committee.
All right, thank you so much. Senator Abler, members of the committee, I am Tiki Brown, Assistant Commissioner for Children and Family Services at the Department of Human Services. Thank you for inviting the department to provide an update on the Childcare Stabilization Grant Program. We do have a slide deck that will appear just now.
Magic.
Just like magic. Okay, so we'll move on to slide 2 here. So by way of background, the Childcare Stabilization Grants were created by the Minnesota legislature to stabilize the childcare industry in response to the COVID-19 pandemic. And so additional information is provided on the slide, references to the federal law and the funding allocation amount. Next slide, please. And so since our last presentation with this committee in October of 2021, we have been processing applications for the Child Care Stabilization Base Grants. We have received stakeholder feedback from representatives from all program types and childcare experts for the Child Care Stabilization Hardship Grants. We have communicated requirements for the Child Care Stabilization Financial Hardship Grants and one-time supplemental grants to eligible programs, and provided technical assistance to programs that needed support through our technical assistance provider, Childcare Aware of Minnesota. The one-time supplemental stabilization grants are a new grant type. It's funded with $20 million from the COVID-19 Flexible Response Account. These funds were prioritized for Minnesota childcare providers in response to rising new COVID-19 case totals in Minnesota. Minnesota childcare providers.
One, right? That's the new
brand
20
new
million,
one.
just like 2 weeks ago or last week or whenever.
Correct.
Right. Okay.
Yep.
Thanks. Just
so that's thank you. That's a brand new $20 million account.
Right.
Minnesota childcare providers will be invited to apply for these grants as part of the January 2022 Childcare Stabilization Base Grant application. So that will be released very shortly. Additionally, the hardship grant application period will open January 26th and close on February 9th. And DHS held webinars with providers yesterday on January 12th to provide information on how to apply for those grants. So in January, we will have our continuing childcare stabilization grants, and then this new one-time funding, as well as the release of the hardship grant application. Next slide, please. And so an update on providers receiving grants. And so we did, on the slide, you will see the funding amounts, $12.8 million so far for family child care centers, 39.9 for child care centers, 3.8 million for certified centers, 79,000 for legally non-licensed providers for a total of 56.6 million. I do want to note that the chart that you all received as a handout does have an error in it. And so we will need to send you an adjustment right after this hearing. Our November data in that chart is low because our initial data pool didn't include the very last day of the month. And that last day of the month is when we receive the most applications. And so the correct data will show a smooth upward participation trend, and all of our data will be slightly adjusted.
So Ms.
my
Brown,
apologies.
the 56 million that's been put out in whatever period of time you've got here, what was the most it could have been? Do you know? If everybody would have applied, is it like 80 million? So do you have a little surplus in your fund? Sounds like you'd have a surplus. Do you know what that is? I know I'm catching you off guard perhaps, but if you don't.
No, that's okay. So we have not yet, of course, released the hardship grants, and there is a significant, dollar pool within there. Our total amounts, I'm going to do a quick call out to my friends to back at DHS to send me a quick update on that number.
You understand my question, though?
Yes, I do.
And so if there is extra money, what happens to that? Does that just go to the coffee fund at DHS? Then probably that's not where it goes. So do we have to reallocate that? Do we have to come up with a new plan? Go ahead.
We don't. So we don't have all the exact data right now, but we would continue to releasing funds available. So for example, that 20 million allocation that we have just recently received, that's intended to be a one-time dollar amount, and we would adjust the funding amount so that it was a one-time release, that it wouldn't continue onward. We have $70 million that's set aside for the hardship funds, so that is remaining and open in the pool.
But I was talking about the base program, and I'm also interested in who's getting the 20 million. But so this number, the numbers you have, the 56 million is out of the legislatively approved childcare program. And so you would have expected to spend a certain amount of money on that. And that's what you're going to find out. The 20 million, did that go to all kinds of providers or just centers?
The 20 million brand new funding is open to anybody. And so
they have to apply.
And they have to apply, correct.
And that's based upon some hardship that they've gotten or something.
So let me separate the two. So the 20 million new funding that we just received from the ARPA funds is really focused in on this current pandemic, and anyone can apply for that, and that would be one-time funds.
And they can do what they want with that, or does it have to go to pandemic-related costs?
They can do what they want for that.
And so, and what was the deadline for that application? Is that closed now? The 20 million
has not yet opened.
Okay, and so then
that will open in the next week.
So when whoever applies, are they going to get a per child rate, or is it going to be like the last thing where the centers get the licensed homes get less and the centers get more? Have you thought that through? We had a discussion about that, if you may recall, and you had a few meetings about that, as I understand too. And so how's that going to go out? So 10 childcare centers apply and 10 licensed homes apply. You're going to divide it by 20 and send it out, or is there a weighting factor?
So we do have a formula based on provider type, and I'd be happy to provide that. We have a lovely chart that we can share. It is based on who applies, of course, right? It's available to everybody, but it is based on who applies. And so that dollar amount will be adjusted based on a base formula, and then is dependent on the number of folks that do apply.
Right, but so just roughly, is it twice as much for a center and half as much for a licensed home? Or I'm sorry to ask these questions here. I have not been briefed on this at all. So I think a lot of people don't know anything about it either. So they're probably all interested. And the licensed home people are busy, and the center people are going out of their heads just trying to keep their places open with quarantines. And I mean, this is not a great time for anybody.
No, it's difficult.
They don't have time to spend on the, reading stuff. So your information is helpful. So could you just comment about that?
Sure, absolutely. So we held webinars with providers yesterday, and we will be able to post those webinars up for folks who weren't able to attend. But we do have a formula. It will be similar to the public health grant. So if you remember, in the early days of the pandemic, we did have a formula that we utilized across the different providers, and we did base that formula. It's similar structure to that. And so I'm asking my team to pull up a little bit more detail so I can share
the original public health
funding with you.
The second iteration that I thought we were following here and then didn't quite work out. All right, well, that's helpful. And I'm not here to badger you. I just want to ask the question, my interest, and I'm not biased toward anyone. I just want to make sure that they're all treated to a point that we can keep them. And it was my observation that many more licensed homes were closing than centers, and there's actually more centers, I'm told. Doesn't mean that they're scot-free, but it's like they're hanging on. And license, the whole point of this governor is giving the 20 million was that childcare is a problem. And if you're losing one huge, whole sector is just evaporating by 1,000 a year or something, sites, that's 10,000 spots or something that is real. So anyway, that's why I keep pushing you on this.
No, thank you. I appreciate that.
It's, yeah, anyway, so then you'll get that to Mr. Yates and he can put that. There'll be a little supplemental update from today's hearing. So keep going. Thank you.
Okay. I appreciate it. Thank you. Yes, we'll provide the full chart, just to reiterate, the full chart that indicates the varying base grant breakdown for each of the provider type, and then any additional information just to help provide context for that.
Yeah, so you can go back to your presentation now. Thank you.
Okay, thank you. Okay, so let me see here. So we just reiterate here, make sure I covered everything. So we will have an updated chart with a little bit modified data just to make sure that everything is on the up and up there. Yeah. And then wanted to make a note to you referenced in the beginning, Senator, an update on the guidance of the mandatory quarantine for childcare settings.
Oh no, go back. So go back. We didn't. This percentage of provide. No, just keep the slide. Go up one more. Oh no, whatever. Yeah, that one. That one there. I'm just the percentage of the uptake. So we didn't talk about that. So I'm interested as I read that a similar percentage of family childcare centers have applied as childcare centers. That's not what I would have thought. I would have thought that the family ones would have been lower and the centers would have been higher. And I'm interested. So that makes me. I'm happy that it's equal. That it's either equally difficult or equally simple. And the centers, of course, they have district staff and so on to do all that. So they're probably better at that. I'm interested that the legal non-licensed are getting their work in there, which I think they're good to have around too. So, all right. So then you're going to talk about the emergency, the 22 million. Can you comment about that? The new and what the criteria are and how that money is going to be. So you can talk about that, please. Sure. So we've covered the base funding. We've covered the 20 million thing as well as we're going to. You'll get more information, which is Mr. Yates will post. And then now if you can comment about the general criteria, how you're doing the 22 million in hardship grants.
Absolutely. So let me just find my place here. Okay, so the hardship grants, so just a note on that. So the department has engaged in multiple engagement efforts with the child care provider network and with providers to discuss the criteria around the hardship grants. We've held several meetings, and our last actually conversation with providers was actually it was just, I think, yesterday. So the hardship grants will be released at the end of the month. And again, a reminder that these are really focused in on providing, we don't intend that these would go to every single provider. The hardship grant criteria is really to help folks that are in immediate crisis. And so, like I said, these will be released at the end of the month. And we estimate that we will have we estimate that the funding will continue as long as there is funding available. So again, depending upon the needs of the participants or program providers as they apply, the funding will be available as long as necessary, and we will adjust and return if things end up being, fairly high.
If a licensed home applies and a care center, just a regular ordinary center, not a certified one, just a regular one apply, how are you gonna, how do you pay them? They say, oh, we need some money. We have hardship here. How do you decide how much they're going to get? Each individual site, never mind the ratio, just like how's that work?
So in our conversations with providers, we did identify a few criteria that would form the basis of what is exactly a financial hardship grant. And then based upon that criteria, we've determined some dollar amounts. I do have a staff person joining that can provide a lot more detail than I can, if I may.
Please.
Okay, excellent.
Actually, we're doing pretty well for time. So this is, we're not going to spend all day on this. You're going to talk, the next thing we'll talk about is the quarantine rules, and then that's the end of our work for the day, pretty much. So,
okay, excellent.
I think it would be useful. I think people are watching, and so yeah, who's your hello friend? Are they going to appear? They're calling.
Yes, we should be able to have Cindy Yang join us. That can give a lot more detail about the specific criteria.
Miss Yang, welcome to the committee. So it's more like drafting a friend is what it's like. So.
It looks like she's signing in.
Good.
If you'd like, in the meantime, I can briefly
why don't you go into the
quarantine
thing, and then we'll just, yeah, so that'd be, because there's been a lot of questions about that, and it sounds like I read in the paper, was it today or yesterday, about your work. So yeah, let's talk about that.
Okay. Excellent. So I think the update on the guidance for mandatory quarantine in childcare settings, quarantining children who are in close contact of a person who has COVID-19 is recommended in guidance from both MDH and CDC. And so as we are in this prolonged surge of COVID-19, we know that a layered mitigation approach, including quarantining exposed individuals, is important. And we also know that widespread quarantines place a hardship on families and providers. And so it has been a licensing requirement of DHS, the quarantining. And so DHS recently lifted that licensing requirement for quarantining and is really focusing enforcement on the reporting of cases to MDH, notifying parents of cases, and isolating children and staff who do have COVID. Now, providers that receive the Childcare Stabilization Grants are still required to follow the public health guidance. And the CDC and the MDH guidance has really been evolving quite rapidly. The Childcare Stabilization Grant is governed by federal regulation, and that federal regulation does require that that any receipt of those funding, that grantees do follow both CDC and then the state's guidance. And so this has been confusing for our providers. It's also been exacerbated just by ongoing changes to the guidance. And so DHS has been issuing clarification and new information to help clear up some of the confusion around this. Our expectation is that providers review their policies and procedures and align their efforts to follow the COVID-19 guidance to the greatest extent possible. We know that they're in a difficult situation with the young children in the homes that they are and in their centers that they are caring for. And so these are recommended guidance and to be followed to the greatest extent possible.
Well, thanks. So is this the 5-day thing, or is this there's no quarantine if it's a brief exposure, or you're just not taking a position saying we're not going to check on that?
So this is the issue, right? There's 5-day quarantine recommendations. There are 10-day quarantine recommendations. The Department of Health.
Minnesota has a 14-day, I think, don't they?
There's depending on the circumstance. So there are a number of different levels of quarantine. And so we're just asking providers to utilize their discretion and follow to the greatest extent possible.
I got it. Senator Murphy.
Thank you, Mr. Chair, and good morning, Commissioner Brown. It is a pleasure to meet you. As you know, I'm a nurse and I'm also an elected official, and the tension I feel between my responsibility as a licensed healthcare provider bound by the Code of Ethics and my work, my dear work as an elected official, which is rooted in, and Senator Abler and I have had lots of conversations about the things that move us, just like he mentioned earlier. Faith underpins a lot of what I do. I don't talk about it a lot, but it is the case for me. I remember at the start of the pandemic when the CDC issued guidance around masks and masking and lowering their standards because there weren't enough masks available, and thinking about my fellow nurses in hospitals and the risks that they would be experiencing because the CDC chose to lower its standard to meet a demand of a product over the care of the people that were working inside of hospitals. Last week, we read an article, we probably have all seen it, about the increased rate of type 1 and type 2 diabetes in children who are infected with COVID. Yeah, and I think it is the case that we can say that we don't yet know what the long-term outcome of this experience for us, whether it is in individuals' health or for all of us together. We don't know the outcome yet. So when I read in the paper about the choice to release childcare providers from the requirement that you had in place around quarantine and handing it to then the childcare providers themselves, urging them to follow their recommendations, but lifting that requirement, I was very concerned about what that means for the families of young children and those young children. And I also think in the midst of what we're experiencing right now with this current surge that is exceptionally confusing for people. And so I want to share that with you because I think it is important for us to be honest with one another and to lift up the concerns and the issues and not as a political critique, but just one more example of where I think we are yielding to the pressure of what we're experiencing at the expense of the health and the well-being of people. And in this case, I'm worried about the childcare providers, I'm worried about the children, and I'm worried about their families. And just want to put that on the record. And I appreciate very much how hard your job is. And I hope you hear that in me as well. So I thank you for your hard work, but I think it's very confusing, and it's gonna have ramifications that we can't see yet. Thank you, Mr. Chair.
Thanks, Senator Murphy. And I think the word confusing is the simplest way to describe it. I saw a cartoon. Somebody was looking at their paper and they said, I just can't figure this out. What, the word find? No, all these quarantine standards, because there's at least 3 of them, which are very confusing. Ms. Brown, I don't think you're in a position to comment much. You're just kind of the messenger. Ms. Rydrick, are you still here? Or did you flee? Mr. Yates, you know if he's still here. There's nobody from MDH left on the call, probably, is there? All right. Anyway, so anyway, what I would have asked Ms. Rydrick, and maybe if I'm sure somebody's monitoring from there. Oh, Ms. Tim John's here. Can you just say hello to us, Ms. Tim John? We can't hear you.
Senator, this is Dan Huff, and I'm here from MDH.
My goodness, I haven't talked to you forever. What a sight for sore eyes. It's I think last time we spoke was about karaoke.
I believe it was, sir.
Not that I would ever want to expose people to that for me. So could you just offer a comment here? And I appreciate Senator Murphy's comments, and I appreciate what the department's trying to do. And we're all very confused. And I actually, one question I have, and then you can opine and we can have a little dialogue about this. We got a few minutes. There's this 5-day thing, which you could call the Delta schedule, maybe, if you're being cynical. Then you've got the Delta airline one, where that seems to have had some impact or other. But and then you have the 10-day thing, which seems to be the old standard. And then there's the 14, which you are still are at. So do you want to offer whatever comment you can on that and where your science and guidance comes from? And I'm not trying to be cheeky. I don't know the answer, and I'm just as confused as anybody about this. So sure. Then if you don't mind standing for questions, maybe somebody will have a question for you. Go ahead.
Absolutely. Thank you, Senator and committee members. So as you know, CDC recently updated their guidance. They announced this right before the New Year's, and then they actually posted their new guidance last year. We at MDH, or excuse me, last week, not last year, last week. We at MDH follow CDC guidance. And so we have adopted the new CDC quarantine guidance, and I'll go through what that means.
Thank you.
However, there's some time for us to get all of our materials updated, as you can imagine. So we put out a statement that says that you can follow the old guidance or go ahead and adopt the new guidance, but that MDE or MDH will be moving forward with adopting the new CDC guidance. So CDC then released specific guidance for K-12 schools. However, they have not released new guidance for childcare. They have indicated that they will be indicating or releasing specific guidance on quarantine and isolation for childcare, but they have not yet. So here is what we are saying for childcare. You can follow either set of guidance until we receive clarification from CDC. Okay. So this is the old guidance. The old guidance recommends a 14-day quarantine and isolation period for those that, and that is considered the most protective or the safest option. There is a reduced quarantine.
And that's following more than a 15-minute exposure to somebody who tested positive. Is that correct?
That is, yes, that is correct.
Okay.
And so if you're a contact of someone that tested positive for more than 15 minutes during a 24-hour.
Just to clarify. So
yep, thank you. Thank you, Senator.
I'm happy I got that right. So
you got it right.
True. Okay.
And so, but that guideline also says you can have a 10-day reduced quarantine, or with a negative test at day 5, 6, or 7, you can do only a 7-day quarantine. So we are still honoring that quarantine guidance. Now, remember, MDH produces guidance. This is not we're not saying it's a requirement. It's the best public health available guidance. But we are also saying until CDC releases the new child care quarantine guidance, you may use the general public updated guidance. And that shortens quarantine period. And see, public health guidance is always a combination of how do we be most protective and most practical. We know that Omicron is sweeping through the country and it's putting getting a lot of people sick, and a lot of people are case contacts. We want sick people and contact people to stay home so they don't spread the disease. But we also know people got to get to work. People need to go to the grocery store, take their kids to school, and et cetera. So this is the revive. I'm sorry, Senator.
No, that's good. And okay. What's the 5-day thing then? Can you just comment on that?
So this is the 5-day. So I'm going to divide it up into case contact. So that's if, I was with somebody or, within, 6 feet for 15 minutes if someone is infected. Then I'll talk about if you're actually infected yourself. So if you're a contact and you're fully vaccinated and boosted, you do not need to quarantine. Fully vaccinated and boosted, do not need to quarantine. You should mask for 10 days whenever you're with other people. And you should test at day 5. If you get symptoms, then you need to stay home until you get a negative test result. And then if you're negative, you can go back, as long as you're masked for that 10 days. That's for vaccinated. If you're unvaccinated, oh, and I will add, if you have been infected within the last 90 days, you're considered in that vaccinated and boosted category.
Right.
If you have been infected within 90 days. So now let's say you've not been infected within 90 days, you're not boosted or you're not vaccinated and you're a contact. Then you stay home for 5 days, you monitor your symptoms, you quarantine for 5 days, then you test. We recommend an antigen test for this. And then on day 6, you can leave the house, stay masked through day 10. And, go out of the house to go to work, to take the kids to school and go to the grocery store. But it doesn't mean you should go to the gym or you should go out for drinks with your friends, because you got to be able to keep that.
Yeah.
No karaoke. Unfortunately, no karaoke during that days 6 through 10, because you got to be able to keep your mask on. So what it is you're reducing the risk, but still it's that risk tolerance being able out and continuing those essential functions. Now, if you test positive, that's where you go into isolation. And if you're positive, your vaccine status does not matter. So if you test positive, you stay home, you isolate for 5 days, and you monitor your symptoms.
Yeah.
Then you test, and if you test negative and your symptoms are either improving or gone and you don't have any fever, then you mask up and you can leave the house for those essential functions, work, grocery store, picking up the kids, until day 10.
All right. Well, I think that, this tutorial here for these last 5 minutes might actually be productive for individuals trying to keep track. I think you've covered everything. Senator Nelson.
Well, thank you, Mr. Chair. I just have some comments about the hearing in general and a request. And I'm wondering, is this the time for that? I don't want to interrupt your agenda.
No, that's fine. I thought you had a vaccine thing.
Nope.
Senator Murphy, did you want to react to anything? I'm not meaning to put you in the spot, but if you're, anyway. Okay.
It is, thank you, Mr. Chair. It is.
All right, thanks.
Yeah, that's it.
I'm trying to proactively include you. I just appreciate you being on the committee. Okay, Ms. Brown, so I think we've done the quarantine thing pretty well. And so DHS's position is they care about all that list, but they're not going to make that a licensing violation if you did something as a hybrid of any of this. And so I think that's the news. I don't think DHS is saying we don't care. I think they're saying as a practical matter, we're not going to take your license away or sanction you for that, partly because it's this complicated. I just took some notes. And anyway, Ms. Brown, do you want to then mention your friend? Did Ms. Yang get here? Oh yeah, Ms. Yang, do you want to comment about the emergency grants? And I think we're going to bring it in for a landing after that, after Senator Nelson comments.
Thank you, Senator. She is here.
Yeah.
Hey.
Oh, she's unmuted. Can you talk?
Good morning.
Yeah, we can hear you. Good. Welcome back.
Thank you. Thank you for having me. Good morning, Senator Chair Abler and members of the committee. I just want to make sure I understand the question. Was the question about the criteria, eligibility criteria for the supplemental 20 million, or was it for financial hardship?
For the financial hardship.
Financial hardship. Okay.
And actually, you're going to send us some more information about the 20 million. And we have no influence on that. The governor can spend his money however he wants. And but on this other 22, the legislature has a great interest in that. So if you could comment about what you've set up based on the criteria, but also how it's going to be passed out. So if a licensed home has a hardship and a licensed center has a hardship, how is the money going to break out differently? You recall we had some significant conversations about this on the base grant part. So go ahead.
Great. So Chair Abler, I do want to note that we also just held 2 webinars, one yesterday afternoon for licensed centers and certified centers, and then in the evening with family childcare providers. The webinar was about the one-time supplemental 20 million, and then also the financial hardship. And so that webinar, we will be posting that up on our Childcare Stabilization website too. So there's a whole lot of more information from that webinar, which I won't, of course, go through now.
Yeah, maybe Mr. Yates could put that in the mix too, because I think a lot of these people are not as sophisticated. I would be an example of someone who's not sophisticated to track all this stuff down. So at least if we could be a point of information for people who are following our committee, that would be good. So Mr. Yates will get in touch with you. But anyway, so just in the short version, what are the basic criteria for the financial hardship grant?
Sure, Mr. Chair. So for the financial hardship, it's intended to stabilize programs facing extreme hardship over a period of up to 3 months. And so grant amount awards will vary depending on provider type for the licensed family childcare, licensed childcare centers, and then the certified childcare centers. So the amounts will vary. Grant amounts have been determined based on the average operating expenses of providers. So for example, the average monthly operating expenses of the largest licensed childcare centers is over 110,000 per month, and while the average operating expenses for the smallest licensed childcare center is less than 20,000. And so the exact amount of awards for providers applying in January will be finalized after the close of the grant application period, because that'll help us determine how many financial hardship applications are we getting. And then it will be based on the total amount of the eligible applicants to ensure that we have adequate funding remains for a second round of financial hardship in February.
Right. So so a big childcare center says we have hardship. Their expenses are 110,000. What's the most they can get?
That dollar amount, we don't.
Well, about. I mean, are they going to get 10,000 or are they going to get 110,000?
I don't believe it'll be 110,000. As I mentioned, it's hard to determine exactly what that dollar amount would be because it would be dependent on how many applications we get.
Right, but what's the most? I mean, you must have a cap that you're not going to give anybody. I mean, I can't imagine a place needing 110,000 because that would be there's nobody going there and they've this wash of federal money, the other grants they're getting, for 12,000 a month and so on. Do you have an idea of what percentage of those costs you might decide you're going to cover?
I don't have that particular data right in front of me, but I do know, given that for the financial hardship, we have placed 70 million aside for the financial hardship. And
is it 70 million?
Approximate now, the highest that based on the data and our calculation and just projections, we're approximating that the highest could be up to $68,000.
And so a licensed home then wants to apply. And actually some of them a lot of them have closed. You're losing a lot every month. So that would certainly qualify as hardship. So they're about to close and this money will keep them open. What's the most they could get?
Let me look here really quick. Sorry, my apologies for the pause here. I'm just
That's all right.
Checking here to make sure that I have the right number here. So the most that we're projecting on for family child care center, Mr. Chair, is up to $4,500.
Is that like per month for 3 months?
This would be per Mr. Chair, how we are rolling out the financial hardship is for 3 months, and so it would be a total of 4,500 up to 4,500 over the 3 month period.
So 1,500 or whatever. So it's spread over. All right. So that's the total. All right. All right. Well, that's helpful for now. Senator Wickland, and we've got about, I don't know, we should really wrap up at noon. So Senator Wickland, I'm not trying to hurry you. Welcome to the committee.
Thank you, Mr. Chair. Yeah, I have a brief question related to the grants. It looked like the percentage of providers that were accessing the grants has been increasing over the June through December, but I'm wondering if there's been any work or is any work going on to increase the numbers beyond the 66%. That's great, but then there are some out there who aren't taking advantage of these grants, and I'm just wondering if the DHS is doing some work to try and encourage more people to apply or understand how we could make that percentage higher. And then I'll also be interested if you can answer the question at some point in the future about projected amounts for the monthly grants versus what's actually going out, and how that will affect the program, I guess, over the year and a half or so that's left in it. Thanks.
All right, Ms. Yang, I guess that who should do this, or Ms. Brown, whichever of you.
Mr. Chair, Senator Wickland, as far as doing outreach, we continuously and are working on increasing our communications to providers. And then, of course, we're working in partnership with our TA partner, Childcare Aware, and have technical assistance support there to also be available to respond to any of the questions. And so from a human capacity perspective, we have increased our capacity to try to work more with our partners to help them understand the eligibility and what each of the childcare stabilization sub-grant programs are. And so the communication and outreach has increased. To the question around the data piece, I'm not sure if I fully understand, but we are similar to the Peacetime Emergency Childcare Grant and the Public Health Support Funds. We are tracking data on a regular monthly basis. And so we do intend to have, once the stabilization program ends in 2023, we will have data available to better understand what the impact has been.
All right. Okay. Any other questions about the child care? I think we're just gonna, so you're gonna send us some information. I do have a comment, and then we'll move on to Senator Nelson, and then that'll be it. So, Ms. Yang, I don't know whose job it was. Now, is this $70 million? I thought it was 22, so I'm wrong about that. It's this the emergency financial grants, whatever you're calling those.
Yes, the financial hardship is we currently have 70 million put aside for that.
All right. And later, I'm also interested, not for now, but what happens to the extra money, we'll have to talk about that. Just we're kind of running out of time. So someone can just let me know that later via Mr. Yates, perhaps. So just frankly, I don't know why the governor needed to put $20 million into any emergency grants at all, especially given, in my mind, that his money is finite. There's $70 million, and it's almost the same kind of criteria. I do hope that you consider who got the 20 before you pass out the 70 to somebody who's gonna, get more of the same. But there's some real grievous issues out there, and the governor put some money out toward helping the group homes and so on. So I he didn't ask me if we thought we should do that, but I want to offer, I guess it'll be a criticism. Senator Representative Pinto and I put together this package where there were some gaps. We didn't even know some of the things we made an error or two, or at least an unintended consequence about how we wrote it. But nobody called me or reached out to me at all to say, what do you think of this plan? And I should ask Senator Wickton if she was reached out to, or Senator Hoffman as the lead on this committee, or Representative Pinto if he was reached out to. But no one reached out to me. And I've commended this agency over and over for their inclusiveness. And now we got a package, which I don't even know what it is, for $70 million, which is going to maybe even be duplicative. And so, Ms. Yang, could you, I don't know who's in charge of this. I don't know if I have the right people on the call here, but I'll just say this as a message that I'm really disappointed about that. And I have no idea what the feedback has been from the different groups. When you did the public health grants, there was a legislative call back in December, I remember, or sometime before they all went out the door, the first batch, and there was input. So I'm going to leave it as a statement. I'm not going to embarrass you by requiring you to answer, but I'm thinking it's a mistake. And we can't have that kind of discussion. In the child care part in particular, we wrestled long and hard about treating all the same. And the public health grants were kind of reasonable for both. And this base grant was way low for the homes. And the centers certainly needed the money as well, but we had different plans about how to do it. And I'm nervous we're doing the same thing here. And I don't know if the money's going to go to the most needy centers or the ones who are the most clever at writing requests. You have a third that haven't applied at all that are centers. And do they even know how to do it? That's a rhetorical comment. So I'm happy to take this offline. This is not the appropriate conversation to have in a committee hearing, but I think we're due for a call. And so that could be set up. Mr. Yates can reach out and set up one of those calls. So I want to just, and Senator Nelson, go ahead.
Thank you, Mr. Chair. Well, I just wanted to really thank you for calling this hearing. And I just wanted to speak to our first testifiers, Tracy Murphy and Christina Kirschner. I just want to thank them. Those were heartbreaking testimonies and hard to hear and hard to comprehend. And I just want them to know that they were heard. And I didn't quite have the place to interrupt as the agenda was going on, but it's just heartbreaking. And I'm so hopeful that we can do better. I'm sure we can. We must. The federal government has sent $62 billion our way in COVID relief. And it's just unconscionable that we're not able to address the needs of our most needy Minnesotans who are probably hit hardest by the pandemic and probably most at risk. So I'm just very concerned about that. And I want to thank you, Mr. Chair, for holding this hearing, and also for the providers for sharing the testimony. And then I just had one comment on the child care grants, and it kind of goes along with this concern that perhaps, how do you know you're reaching those who need this the most? I'm not confident that everybody does know about watching Senate hearings or getting in contact with the department or following webinars. And so I applaud those webinars. I'm going to look at them myself. I realize they're on the webpage now. But what I would like to see is, as these grants are rolled out from the department, I think it would be incredibly helpful if each senator, I'll speak for myself, I want an email in my email box that tells me what the grant is, how much it's for, what's the goal, and where's a link that we can send to our constituents. We all speak to our constituents in many ways. And the best thing that we can do is help get this information out there to them. And so I would just request, as these grants come out, please contact your senators, or if you don't feel like contacting everyone, I'm personally asking you in the departments to contact me with the information, the pertinent information. I don't need pages and pages. I need enough information that I can get to my constituents so they are aware and they know where to go for more information. And of course, timeliness is important. So thank you, Mr. Chair, for your time today.
Well, and thanks, Senator Nelson. So I think what you're saying is everyone in the state that has a question about this should contact your office.
No.
Maybe that's not what you said. Mr. Yates, so I'm just kidding. Mr. Yates, if you could, there's gonna be a number of information items coming to you, Mr. Yates. And they're gonna go on the listserv, and then we'll make sure that they all get sent to each member of our committee. And so Senator Housley.
Thank you, Mr. Chair, and thank you also for this hearing. And I wanted to echo what Senator Nelson said. Thank you to those earlier testifiers and those heartbreaking stories. And to Carrie Thurlow mentioning that our assisted living are no longer in the crisis stage. They are in the stage of collapse. And I just want to make a point, and I didn't want to interrupt anywhere else, but there has been no funding or support for assisted living since the MDH grants back in 2020 at the start of COVID. So March 2020 was the last grant. So we kind of lump this all into one big thing, but our assisted livings are falling through the cracks and they're in the stage of collapsing right now. So we've got to focus on that to Mr. Chair to make sure that we get some help to our assisted living for all of our seniors that are living there. So thank you.
Well said. And you know, I didn't have this hearing to bash the governor or anybody, but I think we got a communication problem. I think if you would, given the long-term care side of assisted living and nursing homes and community supports and services and all that, there's quite a bit of attention paid to interaction of different monies. And this $20 million thing, there was no attention paid to the interaction of the whole $70 million emergency. Maybe the governor should even withdraw that and put it toward assisted livings, but at the very least, got to deal with the dire things. And you know, it's anyway. So I think this has been productive. If the to DHS, I'm just going to offer a little critique here. You've been so good at the outreach on so many areas. On this one, really not so good. So Senator Housley would have cared to be queried. I know that you know, every senator would be interested in this topic, and she was just on my screen. That's why I thought of picking out her name. But I know that, you know, we got to work together. This is going to be just this is almost the worst time for so many of these providers and clients and citizens who are just in harm's way, and the challenges of all the workers and the people relying on good services, both on the childcare side and on the disability side with people with special needs and seniors and people with various challenges. So this has been a really good hearing. I thank everybody for coming. So with that, there will be no more interim hearing between now and session. So anyway, thanks for everybody's work. With that, we're adjourned. Thank you.